Hello. Hello. Manjunath sir.
Sir, good afternoon, sir.
Good afternoon, Santosh sir. Nagnur sir.
Sir.
Nagnur sir.
Call ಮಾಡಿದ್ದೆ sir, busy ಐತೆ sir ಅವ್ರ ಲೈನ್.
ಹೌದ್ರಿ, ಯಾಕೆ
Call
ಮೋಸ್ಟ್ಲಿ
ಮಾಡಿದ್ದೆ sir, busy ಬರಲ್ಲ.
ಸುಬ್ರಹ್ಮಣ್ಯಂ ಸರ್ ಇನ್ನೂ ಜಾಯ್ನ್ ಆಗಿಲ್ರಿ.
ಇನ್ನ ಇಲ್ಲ sir, ಅದೇ ಸರ್ ನಂಬರ್ ಇಲ್ರಿ ನನ್ನ ಹತ್ರ.
ಓಕೆ ಫೈನ್. ಒಂದ್ ಸೆಕೆಂಡ್ ಅವ್ರು ಮಾತಾಡ್ತೀನಿ.
ನಾಗ್ನೂರ್ ಸಲಿಗೆ ಕಾಲ್ ಮಾಡ್ತೀನಿ ಸರ್.
ಓಕೆ.
ಸರ್ ಒಂದು ಸೆಕೆಂಡ್.
ಸರ್ ನಮಸ್ತೆ ಸರ್. ಸುಬ್ರಹ್ಮಣ್ಯಂ ಸರ್ ನಮಸ್ತೆ.
ನಮಸ್ತೆ ರೀ.
myself Dr. Vinod Jadhav.
ಸರ್ ನಮಸ್ತೆ ಸರ್. ಪ್ರೊಫೆಸರ್ ಸರ್, how are you sir?
Sir, fine sir. What about you sir?
I am absolutely fantastic.
Okay sir, fine sir.
How the things are going?
Very soon we will start the session sir.
Definitely, sure.
Very warm welcome to all the participants. On behalf of our department Shalakya Tantra and on behalf of our institution, I welcome you all. I am very much happy that today's our guest speaker Dr. M.V.Subramanyam sir accepting our invitation and given his wonderful precious time and sharing his experience with us. I welcome you sir, and now I am requesting Dr. Nagnur sir, please give an introduction note about our beloved guest speaker Dr. M.V.Subramanyam sir. Sir Nagnur sir, continue sir.
Good afternoon, everyone. Today, I am going to introduce my guide, Professor Dr. M.V.Subramanyam sir, for this webinar series of SUM Ayurvedic Medical College. Sir completed BMS in the year 1987 and MD in 1994. Thank you. I welcome Dr. M.V.Subramanyam sir for sharing sir's knowledge. Thank you.
Nagnur avre, hello, can I start?
Yeah, continue sir.
Nagnur avre,
continue sir.
Okay. Thank you very much. Rajiv Gandhi University of Health Sciences, Bangalore, and Sri Vijay Ayurvedic Medical College for webinar series which are especially postgraduate and PhD students as well as undergraduate students. Today's topic given to me was to understand Kriyakalpa, how these Kriyakalpas have been evaluated, what are the responsibilities of postgraduate scholars and PhD scholars? Let us discuss in a nutshell, because of the time, a less amount of time, we may not cover each and everything. In a nutshell, I would like to deliver some important points about this scientific evaluation of this Kriyakalpa. The term Kriyakalpa, we will come across two words here, Kriya and Kalpa. Kriya is a procedure, Kalpa means formulations and all. The procedures in which on any part of the body we perform some procedures. In Shalakya Tantra itself, we have Mukaroga, we have Mukha, we have Siras, we have Karna, we have Nasa, and we have Netra too, where in individual entities, different types of procedures are performed. Not all the procedures are called as Kriyakalpas, but only this name Kriyakalpa refers to Netra only. The procedures which are done on eye are generally refers to Kriyakalpa. So the Kriyakalpa is the combination of two words, Kriya and Kalpa, the procedures and how these formulations are made, how the procedures are done on eye, everything will be dealt here. Even if we see the gradual how these, Kriyakalpas have been introduced into Ayurveda. While dealing the diseases of head and neck, in his the Trimarmiya Madhyaya, there also we have come across. There also we have come across some ocular therapeutics. Ocular therapeutics are explained. Bidalaka, Aschotana and Anjana, these three were explained earlier in Charaka Samhita. So from there, ocular therapeutics have been concentrated, and gradually from time to as time progresses, from time to Charaka to Susruta, again its name has been new name. Kriyakalpa has been introduced, and a few more procedures have been added. And the time of Vagbata and in Lagutrayi, during such period, one or two more additions have been made. This is the gradual evaluation of these various procedures which are done on eye. So earlier, one entitled and performed by Charaka in his Trimarmiya Madhyaya, in his in Chikitsa Sthana. So from there, gradually the value of the procedures and more procedures have been added due to the time change. As the time changes, new procedures also have been invented by Susruta. And in the same way, Sarangadhara, etc., in Vagbata also, we could able to see some more additions and share the screen. Yes, definitely we will share the screen. So this is all about the basic introduction. Let me share some let me share the screen now. Here you see, this is scientific evaluation of Kriyakalpa. So aims and objectives of this lecture is to, are getting the screen, I think. Is it visible? Some slides I am showing now. So aims and objectives of this of today's lecture is to know how these Kriyakalpas have been evaluated from time to time. What is Kriyakalpa? What are the various procedures done. Now it is it coming? Share the screen. Already it is given. Oh. Okay. Is it coming there? Okay. Now I am introducing some slides to you. So, please, 1 second. So, series of the procedures have been gradually developed in ocular therapeutics from time to time, as I told earlier. So, these procedures have been adapted according to the situation in ancient time, at the time of Charaka. At the time of Charaka, Susruta, Vagbata and Lagutrayi, gradually this number have been increased and the procedures have been newly added. At the time of Charaka, it was only Bidalaka, Asyatana and Anjana. And when time comes to Susruta, it is his responsibility has been more for him to introduce some more procedures. Therefore, Tarpana, Putapaka and Anjana, etc. has been again further added. Then Lagutrayi matter comes at that time, again furthermore, Pindi, Vidalaka, etc. And these procedures have been again incorporated. So, see, by seeing this type of gradual evaluation, it is clearly understood that when the time comes, a new invention must be made. And the same thing has been adopted by them, and it is also our responsibility to manage in the same way. Now let us see what is Kriyakalpa. So Kriyakalpa is Tarpana Putapaka Seka Asyatana Anjanaihi Tatra Tatropadishtane Tesham Vyasam Nivodame. So as per Susruta, there are actually 5 types of these Kriyakalpas. So here you see these are the various names given to these Kriyakalpas. These are the 5 procedures mentioned in Susruta Samhita, Uttaratantra 18th chapter, Tarpana, Putapaka, Seka, Asyatana and Anjana. The above mentioned procedures are collectively grouped as Kriyakalpa, and apart from that, even we can add Pindi, Vidalaka to here. So here you see, let us see what is the very first one, Tarpana, Seka and Asyatana. Yada dosha upayuktam tu na atiprabalam vojasa rogam Asyatanam hanti sekastu balavattaram. Just giving brief introduction about individual procedures. Yada dosha upayuktam tu as per the need of as per the need and as per the involvement of dosha, we have to prepare and we have to perform. Na atipravalam vojasaha, when it is the not accused one, I mean not too deeply seated infections and all, rogam asyatanam hanti. So asyatana, just installation of the drops is more than sufficient. Sekastu balavattaram. When compared to Asyatana, Seka is more effective, more stronger. In this way, Seka and Asyatana we have to understand. Now, actually, Seka and Asyatana, you see, so in Alpa Bala dosha and Alpa Voja Bala, Asyatana is useful, and in Adhika Bala dosha, Seka is useful. This is also explained in Susruta Samhita, Uttara Tantra. Asyatana and Seka, again, there is one more slide in Alpa Baladosha, Alpa Voja, we have to use, and this installation of the medicine. What is Asyatana actually? Installation of the medicine in the form of drops from 2 angulas, from the height of 2 angulas. If the medicine is poured in the form of drops, it is called as Asyatana. So doses as per the need. So this is Asyatana is not only, it's not a simple procedure. Based on the need, again, the procedure, the drugs used will be definitely different. So when Vata dosha, Pitta dosha, Kapha dosha is in such individual dominating diseases, so different types of kalpas you can make, like Snehana, Ropana, Lekana, etc. Snehana generally done for Vata doshas, sir. and is ropana generally done for pitta doshas and lekana for kapha doshas respectively. So snehana ropana lekana dosage is 10 drops, 12 drops and 8 drops respectively. So when there is vishushkata, rukshata, etc., in such conditions when there is dryness, so snehana, in case of inflammatory conditions and vrana conditions and in pitta rattaja ropana karma or ropana aschatana can be done. Also in lekana in lekana 8 drops where kapha dosha like Vartma Sharkara, etc. In such conditions, it can be used. Now let us see what is Seka pouring of medicine on closed eyelids in the form of liquid from the height of Chaturangula. From 4 angulas height on closed eyelid, if the medicine is poured continuously in the form of Dara, Sekastu Sukshma Dara, in the form of Dara, if the medicine is poured, so this is Seka, so its dosage is Snehana from my Matra Kalas. Actually, duration here, earlier it was in when the matter of Aschatana, as it is given in the form of drops, so 8 drops, I mean 8 drops, 10 drops, and actually 12 drops. In case of Seka, the duration of the time for how long this medicine has to be poured on the closed eyelid, it has been told that like Snehana for 400 matra kalas, Ropana for 600 matra kalas, and Lekana for 200 matra kalas. So Snehana is useful in Vata dosha, Ropana is for Pitta dosha, and Lekana for Kapha dosha. And third one, let us see, this is Anjana. Seka Aschatana. Next one is Anjana. Anjana is nothing except the application of medicine or medicament from Kaninaka to Apanga, Apanga to Kaninaka, which is applied to the lid margin, either with the help of a simple finger, which is thoroughly cleaned, or Anjana Selaka, based on the diseases of Tamra, Rajata, Loha, and even Swarna, Selakas are also used, that everybody knows. If you open the textbook, which type of metal is used for which type of disease, we could able to understand easily. So this is from Kaninaka to Apanga and Apanga to Kaninaka, fatal medicine is applied on the eyelid is called as Anjana. So Anjana is Vyakta Rupeshu Dosheshu, where it is done, Vyakta Rupeshu Dosheshu, Shuddha Kayasya Kevale. So disease must be well manifested and should attain Rupa Avastha and Shuddha Kayasya Kevale. So Kaya Shodhana, after all these things, this must be done. Netra Eva Sthite Doshe, then doshas are absolutely restricted and stable within Netra. In such conditions, Praptam Anjanam Acharet. So in such conditions only, Anjana must be done, unlike Seka and Aschotana. Seka and Aschotana are absolutely done for little bit superficial conditions, whereas deeper, if you go on deeper structures, if at all involved, so it is your duty to get the doshas back within the eye, and after getting Vyakta Avastha only, after the purification methods like Shuddha Kayasya, in such conditions only, this must be done. Again, it is of Lekana, Ropana, Chapi, Prasadanam Va. So again, it's of the 3 types based on its the performance or functions, and again it is so it is among Anjana. It is one more slide is Anjana is done. It's one among 5 Kriyakalpas when doshas attain Vyakta Avastha on Samshuddha Kaya. When doshas exclusively limited to the eye alone, application of the medicine along with lower lid margin, which help the Anjana, with the help of Anjana Chalaka, is called as Anjana. So Anjana, it is of so based on the karma, lekana, ropana, and prasadana, based on the function, actually karma. So lekana putapaka for kapha dosha you can perform, Ropana for Rakta doshas and Pitta doshas, whereas Varana, etc., redness, Ushma, and a continuous discharges, etc., Prasadana for Drushti Prasadana, etc. And sometimes even this medicine which is used on based on the Akruti, this can be again further divided into Gutika, Churna, and Rasakriya. So Gutikanjana, Churnanjana, Rasakriya. This is Yada Purvam Balam actually. So then Churna, Rasakriya, then Rasakriya, Gutika. So it is, and next one is on the basis of Anjana again further has been divided into Mrudu and Tikshna based on its Virya. So when Tikshna Virya Dravyas are needed in such conditions, Tikshnanjana is preferred, and on the basis when Mrudu alone is needed in such conditions, Mrudu drugs must be used for Anjana, and on the basis of Rasa again Anjana is further divided into Madhura, Amla, Lamana, Katu, Tikta and Kashaya. So this is one more. So after the application of Anjana, Prathyanjana is absolutely important. Please. After the application of Anjana, sometimes we see when the more Tikshna is etc. used sometimes due of longer in order to prevent further unwanted effects. Prathyanjana is generally done. So it is generally it's a hard and fast principle that after all Samshodhan therapies Anjana, so this Prathyanjana is done after the complete elimination of doshas from eye in the form of tears. So these eyes should be cleaned and Prathyanjana may be applied according to the doshas involved. Here actually Anjana, understanding Anjana scientifically is nothing except, see, once the medicine is applied, that will be, and ask the patient to close the eye and allow the eyeball to rotate thoroughly. This medicine will enter into the deeper structures and allow the medicine into the that allows the deeper penetration to the medicine, and finally which could able to eliminate the doshas which have been already seated. So this will come out in the form of tears. This will come out in the form of tears. Therefore, this Niramatva or disease may be eliminated. Aggressive doshas also may be eliminated, will be eliminated in this way. And the need of Prathyanjana is nothing except to counter any abnormalities, because when as time is only 8 to 9, 6 drops, 8 drops, 10 drops or 12 drops in case of Achyotana, a little bit Matra Kalas on closed eye, little bit duration in case of Seka has been done so far. But here you see Anjana, though it is kept there for a single time, this amount of medicine will be which will be stagnated or arrested within the conjunctival sac for more time. Therefore, there is possibility of the excessive contamination of the medicine to the effective tissue. In such conditions, in order to arrest the unwanted effects, the Prathyanjana is done. So after complete elimination of doshas from eye in the form of tears, eye should be cleaned and Prathyanjana may be applied according to the dosha involved. Next one is Tarpana, Akshatarpana it is. So Tarpayati Tarpana, that which nourishes is Tarpana already. And in when we have everybody knows that it is done in various conditions like in case of Tamya, there are various types of refractive errors, etc. When Vata dosha becomes more Sushkatva, dryness, Katina, in such conditions to attain Trupti and Snehatva to the eye. So this Tarpana is done. Vishushkayati Yadruksham Yascha Atidarunam. This is also refers to dryness only. So Jikhyata, Avilata, 7 dirty eyes, Jikhyata, means squint, etc. In such conditions, all these various conditions, Tarpana is done. So now it is now some more slides on Tarpana here you see, which have been told in textbooks. After Kashaya, after Kayasodana Siro Virechana, and after completion of the digestion of food, we have to perform. When it is done, actually Kayasodana Siro Virechana, and after the complete digestion, Siro Virechana here is Nasakarma. So time is either Purvagna or Aparagna locality in the area, divide of the dust and breeze. Actually, in the Nadi Durdina, it should not be cloudy day or a rainy day. The procedure, patient should be lie down comfortably, construct a wall around the eyes with Mashapishti, fill up this grita up to the level of eyelashes, that is called as apakshmagram. So up to the level of pakshma hair follicle to the eyelash follicle, up to the level, up to such level, grita must be placed, and ask the patient to blink the eyes closely. Remove grita from apanga sandhi by making a hole under masapishti. Completely remove the pishti, wipe out grita around the eyes. Paschat karma is mrudu, sveda, dhumapana, etc. Duration, of course, in swastha, vata, pitta and kapha doshas 500, 1800 and 600 matra kalas respectively. So the Putapaka is one more procedure. Here we have to understand Putapaka is nothing except same procedure done like Tarpana only. The procedure is same. The Aushadha Dravya here will be little bit different. That's all. By Putapaka, Swarasa Paddhati, Swarasa will be extracted by Putapaka procedure. Here actually twice amounts to the volume of drug. So if 2 phalas of mamsa will be swarasa will be squeezed by the procedure of Putapaka, and this swarasa is used for Tarpana, and construction of Mashapishti, etc. Procedure done, allowing the eye to blink, everything will be absolutely normal. So now it is Putapaka. So, sir, now Matra Kala, let us see. In Snehana, Ropana, Lekana, when such procedures are needed, so 200 Matra Kalas. So, Snehana Karma generally done. Snehana Putapaka is generally done for 200 Matra Kalas, especially in case of Vata doshas. Ropana for 300 Matra Kalas. For Pitta doshas, Lekana, in case of Kapha doshas, for 100 Matra Kalas. So these 4 to 5 procedures are called as Kriyakalpas as per Susruta, Seka, Aschotana, Anjana, Tarpana and Putapaka. In spite of that, see, when you gradually go through Vagbata and Lagutrai, we could able to say some Pindi, etc. Bidalaka is also there. Of course, this Bidalaka is first explained by Charaka himself in Trimarmiya Madhyaya. So Pindi is nothing except the medicated kalka will be kept within the cloth, and such that cloth which is containing kalka will be kept on closed eye for stipulated amount of period. Whereas in Bidalaka is the application of Aushadha kalka directly without any cloth, covering on the skin, on closed eye, upper and lower eyelids both will be applied thoroughly, and this kalka will be applied for a stipulated amount of period. Now our concern, how scientifically we have to determine all these things and how these have been evaluated. This is the first concern of this today's. So far, a brief introduction has been given, and now, in a nutshell, let me explore some words about its gradual evaluation. In first and foremost, ocular therapeutics have been mentioned by Charaka. In Aschotana, Anjana have been adopted by him, and also to some extent, Vidalaka is also explained in Chikitsa Sthana. But the matter of little more additions and additional research has been done by Susruta because of his advance in time, and new diseases have been started. And as a basic, as an ophthalmic surgeon, he has to introduce some more medicaments and therapeutics which are more useful and more helpful, because Seka, Achyutana, Anjana and Bidalaka, as per Charaka's, till the Susruta's time, only these three procedures were existing, whereas in Charaka, Susruta Samhita, it was a time for him to adopt some more new procedures like Tarpana, Putapaka, etc. So in this way, these things have been evaluated. So scientifically, so when there is a need, automatically one more drug, one more procedure, one more combinations have been continuously added till the time of Lagutrai up to Pindi and Vidalaka. And this is one. And the thing is, now what we have to do as per in order to explore scientifically, so what we have to do is to evaluate the things before and after these procedures on subject, not on subjective basis but on objective basis. I request all professor and heads of PhD and MD college, MS colleges, postgraduate lecture, postgraduate professors to emphasize or concentrate more on this type of activities which must be handed over to the postgraduate students. So before the treatment, before Tarpana, it is done. So for example, simple example, with this I will conclude. So for example, myopia, so Tarpana is done. We are observing several dissertations which we are valuing also. For myopia, this procedure is done before the treatment and after the treatment. It is the Tarpana is done consecutively for this much amount of period, duration, etc. Everything they will mention in their dissertations. And finally, after treatment, this is the result. Just visual acuity, everything. Subjectively, these people are mentioning, but not objectively. So once we see, now I would like to close it. So in this way, when the procedure, when any procedure is done scientifically, if we want to evaluate, so the objective determination, objective parameters always must be adopted by professors and heads and concerned guides. And one more, when the why not a new more procedure which is more handy, more, because see, evaluation of all these one after another, up to 7 we have, including Pindi and Vedalaka. One after another, everything have been evaluated. So why not one more procedure which may be tried, and such type of creative thinking is more needed in postgraduate students. So therefore, I request you all professors, heads, and other associate professors, assistant professors and postgraduate scholars to emphasize more on invention of some more therapies which are not being explained by Susruta, Vagbata, etc. So some other procedure you can name on your own, and this procedure may be adopted by everyone if it is absolutely helpful. So not simply basing on the things. And also one more, my suggestion is to find out the new medicines, new combinations which could able to give instant reliefs and all. So therefore, in this way, we have to think more in Shalakyatantra research departments. So just in, I would like to conclude now. So Kriyakalpa, this scientific evaluation, today's topic was, so Kriya means the procedure, Kalpa means the formulations and preparations. These two are called as, the combination of these two is called as Kriyakalpa. Though several procedures in Chalakyatantra are mentioned, like Siro Basti, Siro Dara, Siro Pichu, Siro Abhyanga, Karna, Purana, Karna, etc. So Mukaroga, Gandusha, and in no Sanasya Karma. So in this way, there are hundreds of procedures, hundreds of groups of procedures are there, but Kriya Kalpa name always refers to I only. Earlier, in case of Samhita's period, at the time of Samhita's period, in Charaka, only 2 to 3 procedures were explained. Gradually, as the time advances, so advance in new inventions are also made by the Susruta, by adding Tarpana, Putapaka, etc. So further in Lagutrayi period, 1 or 2 more procedures have been added. So therefore, so today's new thinking for us is to evaluate all these procedures scientifically and to invent new procedures by which furthermore easiest way. Thank you very much. And now it is Nagnur.
Sir, namaste, sir.
Yadav.
Sir, really, it's a very wonderful session, sir. Definitely, we heartily welcomes your suggestion and opinion regarding the Kriyakalpas. And I know 100% our students benefited by your speech and motivational also. Now I'm requesting Dr.
Thank you very much. Thank you very much, sir.
Dr. Manjunath, sir, please go for question answer pattern. Is
Good
there any
afternoon, everyone. So thank you for your wonderful session, sir.
Thank you, sir.
So here are some questions, sir.
Sir, please.
Sir, what may be the probable mode of action of these Kriyakalpas? Any more probable mode of action, sir?
Yes, sir. This type of creative things must be created within the departments. See, there was a myth. There is also a myth that when we start doing some procedures, everybody used to criticize that how Aschatana will enter into the optic disc, how it reaches the posterior segment of the eye, and how the Sanjana could able to reach the posterior segment of eye. So you see, for this, I would like to say only one thing, sir. While performing, when Aschatana, allopathics generally, they used to criticize that whenever anything is installed within the eye, or any such medicament procedures which is absolutely topically done on eye, so this will be alone restricted only to the anterior segment but not the posterior segment. Therefore, all these Kriyakalpas are myth, somebody used to say. But my simple answer to such type of this thing are for us to better understanding for our students is that whenever a drop or any installation is done here in the form of Aschatana, Seka, or Tarpana or Anjana, so definitely that goes to the posterior segment too, sir. For example, one thing, while performing refraction, a mydriatic action is required where pupil must be dilated. When anybody want to see the pupil in a dark room, when anybody want to perform ophthalmoscopy or retinoscopy, so enough amount of dilatation is required within the pupil so that posterior segment is clearly seen. For that, they used to install drops before refraction. In these days, auto refractometers have come. There was no need of any such dilatations. But earlier days, they used to install drops and they used to get dilatation so that they could able to go up to the posterior segment too. Through bloodstream alone and through blood aqueous barrier, this type of external medicaments will enter into the deeper structures. Ashyotana, Seka will function like this only. And for us to better uh, availability of drug within the posterior capsule, within the posterior segment, Susruta has invented this type of Anjana, etc. Anjana, Tikshna Anjana, Mrudu Anjana, Madhura Rasa, Amla Lavana, Katutikta Kashaya, Tikshna Mrudu. In this way, Anjana is applied and patient is allowed to close the eyes thoroughly, closely, and he will rotate around all over, and this medicine will enter into. And finally, you see, sir, this medicine, especially in case of Anjana, the drug will be retained there within the conjunctival sac, and gradually its Aushadha Amsha will be entering into the posterior segment, so that through blood stream, through aqueous barrier only, through aqueous humor, etc., and through vitreous, everything will enter into. One more thing is, we are absolutely forgetting this hyaloid canal, sir. Hyaloid canal is nothing except the residue of the fetal life. During fetal life, the lens, during fetal life, through hyaloid artery, lens, crystalline lens is to be nourished. That everybody knows, we know. And gradually after birth, it attains transparency, that will become transparent. Gradually this hyaloid artery, which is the branch of central retinal artery, will be seized back, and finally leading to a vestigious transparent canal like hyaloid canal. The moment drug or Aushadha Amsha, potency of the drug or drug itself, enough to enter into the anterior chamber. From anterior and posterior chamber, once it reaches, automatically that reaches to the posterior capsule also, posterior aspect of the capsule also that reaches, and through hyaloid canal that reaches up to the optic nerve also, sir. In this way, we have to understand. This will be more in case of Putapaka, sir. This will be seen more in case of Putapaka. When compared to Tarpana, Anjana, Aschyotana or Seka, Putapaka is the topmost procedure which has been adopted by us. Because Agni Samskara is done to the medicine. Agni Samskara is done to the medicine, sir. My dear students, all over the India, so kindly have some, please concentrate on my words. Putapaka is the procedure through which medicine is squeezed. Aushadha Amsha will be squeezed forcibly from Agni Samskara. Once Agni Samskara is added, automatically everything Guru will become Lagu. The weighter substance also will become lighter. When there is more Lagutva, faster the penetration into the deeper tissues. It is not Triphala should enter into. It's a Triphala Samsha, if at all enter into also, that's more than sufficient. For this only micronization. So this is what we have observed from Seka Aschyotana to Putapaka, as these procedures have been evaluated one after another. Micronization of the medicament or medical active principle is also is possible. So therefore, due to this micronization, due to this Agni Samskara, it's a deeper penetration and all is done, sir. In this way, we have to think. Furthermore, how this conjunctival sac, anything which is given, either Putapaka, Tarpana, or Seka, or Aschyotana, whatever it may be, Anjana, first everything will be subjected to conjunctival sac, and from conjunctival sac, that will be absorbed within the tissues, at least for healing. And this greater the penetrating, the micronized particles will enter into the posterior segment from posterior chamber to posterior chamber, and from posterior chamber directly into the vitreous humor. And there is a big canal which is existing there, exactly from posterior aspect of the posterior most point of the crystalline lens to the optic disc. Hyaloid canal is there, which is a residue. Actually, this is a transparent canal which is existing even in adults too. How this is prepared during embryonic life for giving nourishment to the crystalline lens. The central lateral artery has sent its one branch, hyaloid branch to the lens. But after birth, as the lens become transparent gradually, this blood supply will be seized out. That way, blood supply will be withdrawn from hyaloid artery. Therefore, a canal is there, hyaloid canal. Directly from that canal, these medicaments, everything will enter into up to the optic disc and optic nerve also, sir. In this way, we have to think. Furthermore, thinkings and research procedures are anticipated from all of you, sir. Thank you very much, sir.
Okay, thank you, sir. Thank you so much. So it was a good information. So coming to next question, sir.
Sir.
So these Kriyakalpa procedures, is there a thing called these procedures can be done? Some procedure can be done in Amavastha and some can be done in Niramavastha. So like any specific procedures, sir?
Sir,
Like,
Suddhakaya Sekyavale, this everything, sir, Ama Pakva, separated based on the by within Amavastha. So in Niramavastha, some procedures are done. In Amavastha, some procedures are done, sir. So Niramavastha, Suddhakaya Sekyavale, like that, when we come across, it should be Niramavastha only. And in Amavastha, for instant relief, that also may be done. In Amavastha, when there is more Amatva is there, so for Ropana procedures, etc., so we cannot we cannot attain Niramavastha in case of Pitta and Rakta doshas generally. In such conditions, in Amavastha also, it can be done, especially in case of Kapha Rogas, sir, where Lekana procedures are done, where Tikshna Aushadhi, like Tikshnanjana, etc. So that may be considered as Amavastha only. Therefore, also now we cannot restrict the Kriyakalpas exclusively to either Amavastha or Niramavastha, sir. Both based on the need we can use. And some more discussions are needed in this regard. Thank you very much, sir.
thank you, sir. Thank you so much. So, okay, if any questions are there from other side, the discussion session is open.
May I conclude, sir? One more word. I have to say thanks to KC Das and all. So after please give me some 1 or 2 minutes time.
Sure, sir. I think questions have been cleared, I think so.
Okay, sir.
No questions from our side. Okay, sir. Thank you.
Okay. Thank you very much. Sri Vijay Mahantesh Ayurvedic Medical College, Ilkal. Thank you, sir. Dr. Santosh Pujar, Dr. Vinay Jadhav, etc. Everybody, all are there on the screen. Especially my indebted thanks. I am very much grateful to Professor Keshav Chandradas, sir, Principal of SVM Ayurvedic College, Ilkal, for providing me the opportunity to deliver some scientific thoughts on the Kriyakalpa. My sincere thanks to Professor and Head of the Department of PG Department of Chalakya Tantra there. One more, my sincere thanks to my student, Professor Naganur. He was my direct student. I have guided him, and now he has become professor. I am absolutely happy that my students have become professors there. And thank you very much, Madam Associate Professor, Sir, Associate Professor and Assistant Professors, all are in the department. And other all over Karnataka and all over the India, whoever observing my lecture, thank you very much, one and all, for patience hearing. And I need your suggestions also for me to improve myself. My email address is ayurvedicprofessor@gmail.com, ayurvedicprofessor@gmail.com, for your further queries, for suggestions, and if you want to suggest me to improve myself, please mail me to ayurvedicprofessor@gmail.com. Thank you very much. Thank you very much, sir. Naganur?
Thank you so much, sir. Myself, Dr. Santosh Pujar,
Sir, thank you, sir. Thank you very much, sir.
Thank you so much, sir. On behalf of our principal, sir, Dr. Kesidas, sir, and on behalf of our Shalakyatantra department, and especially on behalf of our HOD, sir, Dr. Vinod Jadhav, sir, and
Yes, sir.
Professor Dr. Nagnur, sir, and Assistant Professor Manjunath, and Dr. Santosh Puja, and Dr. Prema Jigli, madam. Thank you so much, sir. And especially on behalf of all the PGs and uses of ILCAL, and not only ILCAL and out of ILCAL. Thank you so much, sir, for sharing wonderful knowledge regarding this Kriyakalpa. Thank you so much, sir.
ಸೊ ಅವ್ರಿಗೆ ಸ್ವಲ್ಪ ಪರ್ಸನಲ್ ಆಗಿ ಕೇಸಿದಾಸ್ ಅವ್ರಿಗೆ ಸಾರ್ ನೆನಪು ಮಾಡಿದಾರೆ ಅಂತ ತಿಳಿಸ್ಕೊಡ್ರಿ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಸರ್.
Okay, sir. Thank you, sir. Thank you so much.
Okay. Okay, sir. I am leaving the meeting, sir.
Thank you, Agenda. Thank you.
Okay, thank you, sir.
Thank you, sir.
Okay, sir.
Manjunath, sir, end the meeting, please.
Yes, sir. Santosh.